Hello, everyone. Thank you for being together. My name is Woutrina Smith. I'm the Associate Dean of Global Programs at the University of California, Davis School of Veterinary Medicine. I'm very happy to be with you to give a brief overview of the One Health idea and also planetary health as an important focus for One Health in our current world climate. I will give you some examples, and I would love to hear from you if you would like to talk about these things further going forward. This is a headline from my newspaper from last week. I'm based in California, but I work with partners all over the world. And one of the things we work on is outbreaks. This is an outbreak that was making people sick with diarrhea. They were being very sick, and you might assume, maybe it's from the hamburger, from the meat, because there have been previous outbreaks of E. coli coming from hamburgers. But in this case, it was traced to the onions. And so it was a surprise. It wasn't what we were expecting. And the way we figured it out was by really using the One Health approach to consider the connections between humans, animals, and our shared environments. And food safety is a big part of that. We can talk more about examples that might be relevant in the areas that you're interested in. I'm part of the University of California, Davis, where we have one of the top-ranked veterinary schools in the world. And that means that we have a chance to work with many types of animals, many types of people, and to think about how we can all work together even better going forward across our different organizations and countries. I've been very honored to work with partners in Chile for many years, and we like this One Health idea that we can work together on various challenges. Zoonotic diseases shared by animals and people are one of my favorite topics to work on. And for any of those challenges, we need to think about what's causing them. What are some of the drivers that lead to those challenges? Maybe it's land use change. Maybe it's the movement of people and animals. Maybe it's changing environments or economics. So those drivers are also affected by cross-cutting influences. The soft skills or the soft topics like our culture, our economics, our policies, our behavior, those drive the decisions we each make every day. And that affects the health risks and the diseases that may be involved for us, our family, our animals. So this idea of One Health recognizes that we should look for the connections between people, animals, and our shared environment. And it also represents teamwork or collaboration to be able to have evidence-based policies that can inform and keep populations healthy going forward. So if we think about applying the One Health approach, whether it's in California or in Chile, we may be thinking about top-down ideas that are led by government programs and policies, or we may think about bottom-up approaches that are more grassroots or that come from the communities. Both are important, both are good, both can lead to change that will help to keep our people and animals and environments healthy. So the planetary health idea says we care about the health of ourselves, of our populations, of our environments, and also of the world that we share, the planet. So we need to recognize that what we do in one country may affect what's going on in other countries around the world. So some of us are doctors. Maybe you're a doctor of animals, maybe you're a doctor of people, maybe you're a policymaker who influences all of these things. They're all very important. But if you see the gentleman in the photo, he's thinking about how to keep his animals healthy, how to keep his family healthy. And I know that the water that those animals are walking through is also the water that he drinks and that they bathe in. And so the diseases of the animals and the people can be shared very easily because of their shared environments. And some of the work that we do with these communities is to understand how do diseases move and how can we keep everybody healthy by working together. Here's another patient that I've worked on. I do a lot of research and partner with colleagues that focus on wildlife. This is a wildlife called a sea otter. I hope all of you will get to see one someday. And this animal came in, all of them come in for understanding causes of death. This one has yellow gums, yellow ribs. It's jaundice, just like you would see in people. So we can use animals to give us hints about what's going on with the animals, but also about what might be happening with the people. And so by studying sea otters, they are sentinels. They teach us about what's happening in those environments. And the animals that were getting sick and dying from, in this case, toxic algal blooms, help to alert us that those algal blooms might be a problem for people and domestic animals also. So we discovered in sea otters, but we really pursued it because of the public health implications. Once we knew that these algal blooms were a problem, we wanted to study where are they coming from and how can we protect population health. So we had to do a lot of education to raise awareness. Where are the dangerous areas? How do we try and prevent further illness or death? And how can we fix the problem? So for all of these things, we needed a team-based approach. No one person will have all the answers. And so it was really fun to see how different experts came together, local community leaders, some of the different communities that wanted to understand the problem and prevent it from happening in the future. This problem was especially challenging because the toxic algal blooms were coming from the inland freshwater lakes. And there was so much toxin in the water that even flowing down through the creeks and the rivers to get to the ocean where the sea otters live, there was still enough toxin there to kill sea otters, and I'm sure to make animals and people sick if they were to come into contact with any of this. So there can be very dangerous events that we can learn about more quickly by working together and to be able to protect public health. Planetary health, as I mentioned, is thinking about how these ideas of health risks or protection of health can be scaled to the environment and to the planet level. One of the organizations that I am part of is the UC Global Health Institute. And what I like about it is it works across all 10 of the University of California campuses. So as with some of the universities in Chile, we have more than one campus, and all of us can work together through these programs that are overarching to come up with new ideas, new training programs, and to move forward on collaborative research. The planetary health is represented here. We still want our One Health approach to work together on teams, to work across different areas of expertise, and we can apply it to the health of our individuals, our families, our populations, and our planet. So this is something that I think will become more and more important as we recognize that climate change and the effects of people on the environment are probably getting worse instead of better. This is a ranch in the mountains in California. This is my ranch, and it's a mega fire that you can see glowing in the background. So these mega fires that are happening more and more in different parts of the world are happening perhaps partly due to climate change, but also because of land use change, right? We change how we affect our environments by preventing controlled burns or coming up with different approaches that might stop things for the short run, but in the long run can create very catastrophic events. So thinking about fire and climate and land use is very relevant for the health of populations. On that same ranch, we're studying what's changing with the climates, with the fires, before and after. We're studying nature-based solutions. How can we make it better? In this case, by slowing down the water so that it will stay in the ecosystem and really be able to work for public health and animal health, and thereby keep carbon coming into the grasses and come out of the atmosphere. So a combination of technology, but put into social contexts, is an important part of One Health. And this is a living lab where we study it, and we have students and faculty and many visitors come. You're all very welcome to come and work with us. But it's not just California. This is in East Africa where I work, and we need to think about how we can really look at what's happening with the animals and the environment and the public health, in this case related to trash that's washing up on the beaches every day. How do we come up with new ideas on how to fix these problems? In order to do that, we need the community ideas, we need the policy leadership, and we need to connect across different groups. So at the One Health Institute, we are working together on many different programs. But one thing that I like is as we work with ministries in different countries, those ministries are often finding ways to connect in new formats. Maybe it's a task force on One Health, maybe it's a committee on One Health, Maybe there's someone who is thinking about the One Health approach in each of the ministries or departments, and they know how to contact their colleagues in the other departments in order to come up with ideas or share information very quickly. So my area of expertise is infectious diseases. That's why you hear me talking about that. But I apply them to the planetary health ideas and work with partners in many places. Others at UC Davis are working on some of the disaster preparedness and response programs, and other aspects that you can see here. So I'm going to stop here for my talk today, but I would be very happy to follow up. I hope that this gives a few examples of the One Health approach and how we can really think about working together going forward across our colleagues and organizations in the United States and in Chile to build on what has started in such a nice way. Thank you so much.